Related to the community levels, the next question says, it appears that the transmission data is being buried in favor of a new community level that really only indicates the community's ability to withstand disease loads. Why are transmission levels being downplayed?
So I'm happy to take that. And as we noted in the initial points, that we really have evolved to a different phase of the pandemic. And as a result, it's really critical, given the increase in vaccination rates and the other progress that we've made on a lot of variety of indicators, to really shift in the way that we look at the available data to ensure that we're really focusing on the greatest burden on society and where there's going to be that stress. And so ultimately, that's where the COVID-19 community levels land, in terms of focusing on those three critical levers in terms of the impact on not only the healthcare system, but also the COVID-19 case rates. And so it really is consistent with the fact that this is an incredibly dynamic pandemic. But as we build more data, as we get new information, so must we evolve with it and ensure that we're really focusing our efforts and using the data to really focus on the greatest burden on society at this phase. And that's really focused on those three measures that we've ultimately landed on in terms of the cases and the burden in the hospitalization sector, to really keep our pulse on what the greatest burden is and potential strain on those various indicators. So we'll continue to monitor moving forward, but right now at this stage in the pandemic, we've really shifted from those transmission rates, given that we have those tools available, and that we really want to focus on the greatest strains on society to help make those evidence-based informed recommendations to the public.